You've been diagnosed with cancer. You are facing complex choices involving chemotherapy, radiation, and novel drugs. But what if we told you that hidden within the very metabolism of cancer cells lies a fundamental weakness that can be targeted? This vulnerability is known as methionine addiction, or the Hoffman effect. Unlike healthy cells, cancer cells require a significantly greater amount of the essential amino acid methionine from outside sources to survive. Why? Because they use methionine excessively for transmethylation reactions, processes crucial for cancer growth, survival, and malignancy. By exploiting this methionine addiction, we can apply methionine restriction, MR, a metabolic therapy often combined with standard treatments to enhance their efficacy. This combined strategy is often termed the Hoffman protocol. Methionine restriction, MR, uses two primary components. 1. The low methionine diet. Patients follow protocols such as the Nutritional Oncology Research Institute and NORI protocol, recommending intake of less than 2 mg of methionine per kilogram of body weight per day. 2. Oral recombinant methionine, ORMetase. This enzyme, cloned from the bacterium Pseudomonas putida, is taken orally as a supplement. The brilliance of ORMetase lies in its administration. It degrades methionine right in the gut, which subsequently lowers methionine levels throughout the circulation and within tumors. Crucially, ORMetase itself does not typically enter the bloodstream, eliminating the risk of severe side effects like anaphylaxis associated with older injectable versions. In reported cases, ORMetase has shown no overt side effects. The synergy. When cancer cells are starved of methionine, they become selectively arrested in the late SG2 phase of the cell cycle. This makes them acutely vulnerable to standard chemotherapy drugs that target cells undergoing replication, creating a powerful synergistic effect. We have multiple remarkable clinical case reports involving methionine restriction for breast cancer. Anidatman Tabo Alboan An. Advanced HER2-positive metastatic breast cancer. A 66-year-old female was treated for recurrent stage 4 disease, including extensive peritoneal dissemination, colon thickening, and widespread bone metastases. Prior standard treatments had failed. The treatment. She received a combination of low-dose trastuzumab deruxtecan, TDXD. The dose was lowered due to strong side effects, along with daily ORMetase and a low methionine diet. The result, tumor biomarkers CA15-TER3 and CA27.29, which were at very high levels, rapidly decreased to normal limits. Critically, CT scans revealed that the peritoneal dissemination nodules, ascites, and thickening of the sigmoid colon and splenic flexure were no longer detected. Invasive lobular carcinoma, ILC. This type of breast cancer typically responds poorly to chemotherapy alone, with low complete response rates, around 3% to 5.9%. The treatment. A 62-year-old female with metastatic axillary lymph nodes received standard neoadjuvant chemotherapy, doxorubicin, cyclophosphamide followed by docetaxel, combined with ORMetase, 250 units 4 times daily, and a low methionine diet. The result, after just 3 months, CT imaging showed a loss of the axillary lymph node metastases. The patient achieved a complete response, CR, demonstrated by MET-PET imaging after 6 months of combination therapy. Extensive metastases, eradication. Another breast cancer patient with widespread metastases in the lymph nodes, pleura, bone, and liver, whose initial hormone therapy failed. The treatment, second-line combination therapy included radiation, immunotherapy, BAK therapy, a low methionine diet, and ORMetase. The result, after 5 months, FDG PET scans showed the almost total eradication of extensive metastases in the lymph nodes, bone, and pleura. Methionine restriction has shown promising results even when used as a supplement alone for advanced prostate cancer. Bone metastatic prostate cancer. A 76-year-old male with highly advanced bone metastatic disease had an extremely high PSA level, over 2,000 Dao-Neng mol. And the treatment. He took ORMetase, 250 units twice daily, as a supplement alone for 3 months. The result, his PSA levels dropped approximately 70% during this period, and his general performance improved, including an increase in his hemoglobin levels, from 7.4 to 8.7 gdl. Long-term stable prostate cancer, a 66-year-old male with metastatic lymph nodes who had received surgery and radiation opted only for methionine restriction. The treatment: he was treated only with OR Metase, 250 units twice daily, and a low methionine diet for 2 years. The result: his PSA remained stable below 2 ngmol, and a metastatic lymph node confirmed by PSMA PET showed no growth, with a decrease in standardized uptake value, SUV, from 19.39 to 14.98. For challenging gastrointestinal cancers, MR proved synergistic. NRAS mutant rectal cancer. Recurrence: a 59-year-old female with lung metastases was experiencing rapid tumor growth, with CEA levels rising to 139.91 ng/ml after initial chemotherapy failure. The treatment: she restarted FOLFIRI and bevacizumab, this time adding MR, OR Metase twice daily plus low methionine diet. The result: her blood CEA levels plummeted, decreasing by 97% to near normal limits within 5 months, and the lung metastasis was stabilized. This synergy is likely due to FOLFIRI's components, 5-FU and irinotecan, targeting the S phase where MR traps the cancer cells. Rectal cancer, MR alone. A 55-year-old male with local recurrence who refused further chemotherapy was treated solely with MR, OR Metase plus low methionine diet. The result: he achieved long-term stable disease for 1.5 years, with stable CEA and unchanged tumor size. Pancreatic cancer has an extremely poor prognosis. The data here is especially noteworthy. Stage 4 pancreatic cancer. Rapid response: a 63-year-old female with massive liver metastasis. The treatment: FOLFIRINOX, later changed to GemNab-PTX, combined immediately with MR, OR Metase 250 units, twice daily, plus low methionine diet. The result: over 5 months, the primary tumor size decreased by 40%, liver metastasis regressed, and the cancer biomarker CA19-9 decreased significantly by 86%. Stage PAR. Pancreatic cancer, long-term stable disease. A 62-year-old female, 12 months after starting FOLFIRINOX for stage PAR disease, added MR to her treatment, FOLFIRI continuation, plus MR. The result: her tumor size and CA19-9 levels remained stable 19 months after diagnosis. Historically, this is a highly rare result for stage 4 pancreatic cancer patients treated with standard FOLFIRINOX alone. High-grade glioma, HGG. This is a highly recalcitrant brain tumor, highly addicted to methionine. The average survival is typically around 9 months. The treatment: a 16-year-old female received first-line radiation and temozolomide, TMZ, combined with MR, OR Metase, twice daily plus low methionine diet. The result: the tumor size shrunk at least 60% by 9 months and remained stable for 19 months. Chronic lymphocytic leukemia, CLL. CLL is characterized by disordered DNA methylation. The treatment: an 85-year-old female with rapidly progressing CLL, WBC count peaking at 195/103 DUL, received CLL chemotherapy, rituximab and acalabrutinib, combined with MR, OR Metase after each meal, plus low methionine diet. The result: her WBC count rapidly declined to the normal range, and extensive lymphadenopathy disappeared, leading to an apparent complete response, CR. These real-world case reports demonstrate that combining the metabolic strategy of methionine restriction with standard oncology treatments can lead to powerful synergistic results, often in cancers that have previously failed conventional therapies. Key takeaways: targeting the hallmark methionine restriction targets methionine addiction, a universal and fundamental hallmark of cancer. Synergy and enhanced efficacy. By synchronizing cancer cells into the SG2 phase, MR significantly enhances the effectiveness of common chemotherapies. Safety profile. The oral administration of OR Metase, typically 250 units twice daily as a supplement, has been well tolerated in patients, with no severe side effects reported in these cases. While these case studies show great promise, the sources emphasize that further clinical studies and randomized clinical trials are urgently needed to determine the generality and optimize the use of this combination therapy for broader patient populations.